Hi, Dr. Dave here, and I'm going to answer the question, how much care do I need? How much chiropractic care do I need? What kind of care plan do I need? How many adjustments do I need? What I'd like to do is start by explaining it by showing you a picture of what I would consider your bounce back factor. If you have good resiliency and good bounce back, you don't need as much. Your body can do more of that. If you're really low in vitality, you don't have much bounce back, you're going to need a lot more help, a lot more hand holding. So if we create a chart, at the top of the chart we have a lot of bounce back. You have a lot of stress tolerance, a good sense of vitality, a lot in the bank account, so to speak. Injury happens, stress happens, it might knock you down a peg, but you can come back up to some degree on your own, right? If you're down here, you might not have much cushion, not a lot left in the bank right now, so the wind changes directions and it might crash your system. So think in terms of, I can bend but I won't break. I can bend and I might crack. Bend and I might break. Down here I'm going to crash or shatter. The way this works is you're typically born up here somewhere, right? Higher vitality, more bounce back. Things happen over time. Lifestyle, diet, sleep, stress, injuries, what have you. And you get to a point where maybe you drift below this line. We call this the symptom line. And where you used to be able to fix yourself or do whatever, you can recover, but now you're just not recovering very well, and then things are hurting worse and more often or whatever. And then we come to the chiropractor and it takes us a handful of visits or whatever it takes. We get past that symptom line. Now you're feeling better. So the question really is, are you done? Well, if your only goal was to feel better, then yes, absolutely, you're done. If your goal was to become stronger, more body efficient and better functioning, and so your body can take care of itself better, well, there may be a little bit more work to do. So most people would like to be vital, high vitality and thriving and all those kinds of things. It takes a little bit of effort. It takes correcting a lifestyle. It's not just a magic bullet. So it might take a little bit of effort to get up that mountain again. Very doable. So you might need a short care plan, 3, 4, 5, 6 visits, sometimes a little more. Other times we need to work on core strength, or we have to do something with your posture because you've already let things slide to a point. Well, that might be a little bit of time of what I call stabilization care. So if this is relief care or what I call recovery, usually short-term stuff, this would be considered stabilization. So once we get past this line, if we just stop altogether, if you're down this low vitality, most likely you're going to drift right back down. So we want to stabilize that as best we can. It's usually lower frequency visits. It's easier to do. You're feeling better already, so usually it's an easy win. And then at some point, you're higher up the scale and you're done. And at that point, either we can decide to maintain that, come in periodically if you want to. Over time, if you don't change your lifestyle, you will drift down again. Just a matter of math and physics. Or you can keep that going up to some degree, doing something that would be considered wellness care. So we'd see you off a higher frequency, maybe for some people it's once a month, for some people it's once a week. I personally get adjusted every week. That's being proactive. It's more adjustments than you need. However, it depends on how you define need. So it's your choice. We never make any of our patients do anything they don't want to do. But you're the one that has to grow old in that body. So these decisions, and they are decisions, are up to you. And we always want to find what fits best for your situation and your willingness. So that's the big picture. Hopefully that answers some questions. It's not magic, it's just physics. So it's just a matter of doing enough of the right things over a period of time to yield excellent results. Until we speak, live your life well.